Hello and welcome to the Microbiome Medics podcast. I'm Dr. Siobhan McCormack.
And I'm Dr. Sheena Fraser, and we're your co-hosts.
We are both GPs and lifestyle medics with a shared passion for microbiome science. We'll be translating the evidence and packaging it into actionable, bite-sized chunks so that you can harness the power of the microbiome to improve your own health and that of your patients.
Hi, we're back. The Microbiome Medics. We're back together again. Hi, Shiv. How are you doing?
Hi, Sheena. I am great. It's really nice to see you this morning. And yeah, it's nice to be doing a podcast with you. Much as I love all these other fab guests, it's kind of nice because we can kind of relax and just talk about our obsession together.
Yes. And actually, you know, it's lovely because there's so much we can talk about. And because it's been such a long time since we got together, we've also been doing lots of things separately and together. So we should probably let the listeners know what we've been up to as Microbiome Medics. When was the last time we got together? Was it October? I think it was way back.
Yeah. So I suppose it's... I kind of think it's important for people to know that we're both jobbing GPs. You know, this is kind of our sideline obsession, which we don't get paid for. We do all this out of love, which much to the sort of shock of friends and relatives, I think. So I think, why are you doing this? And I guess we just kind of think it's really important. We love it. And like you, I see microbiome science as, you know, really central to my job as a doctor. And I try and get it into consultations as much as possible. But obviously there are time limits. We kind of get 15 minutes per patient in general practice. So it is really difficult to try and introduce it, although I think both of us do. So that's why all these other things like doing the podcast and going to meetings and conferences is a way we can kind of really indulge ourselves with the kind of getting up to date with all the latest science. And yeah, we love it. So I don't know, what was the last meeting we did together?
I guess the last meeting we did together was the anesthetics meeting, and that's going to lead us into this podcast. But yeah, we went down to London together. We were presenting at the Royal College of Anaesthetists. So nice to be asked by them to come and present. And we presented our version of anaesthetics and the gut microbiome, which was really exciting to research as well. Just another fascinating area of microbiome science. And I really enjoyed it. I have to say, what a lovely bunch down in London, and what a lovely bunch of anaesthetists we met.
They were. And I was really surprised because I have to say, I suppose I put anaesthetists together with surgeons who, wonderful as they are, I don't see them as being particularly interested in, you know, either lifestyle medicine or the gut microbiome, and how wrong I was. And, you know, when we take on a new subject and look at it from a different mountaintop, look at a different perspective, I just learn so much. Because when we started looking into this subject, so the Royal College of Anaesthetists asked us to talk about the gut microbiome in anaesthetics. And I kind of thought, yeah, we always say yes. And then afterwards, you put the phone down, you think, oh, gosh, I don't know how's that going to work? And what is the role of the gut microbiome in anaesthetics? And it really kind of gets you thinking. But maybe before we jump into that, there was also in March, we met in Edinburgh, which was lovely, with the British Society of Gastroenterology doing their first gut microbiome conference, which was, you know, fantastic. It was, I think, I've got the name here, Transforming Medicine Through the Gut Microbiota Interface. They were talking about microbial therapeutics and human diseases. And that was all the great researchers in the UK meeting together, which are a very impressive bunch of researchers from all over the country. And that was very intense and very exciting. But also, I suppose, very conventional medicine based, in that we're lifestyle medics, so we're trying to get this down into primary care. So these very complex and highly researched areas which aren't being translated yet into primary care, you know, they're going to take 10, 15 years to kind of get to us, really, some of the stuff they were talking about. I don't know, what are your thoughts about it?
That's a bit of a depressing thought for me, but yeah, it was interesting. It's nice to see a load of secondary care colleagues from fields like gastroenterology, surgery, medicine, who are really interested in microbiome science. And that certainly came across at that meeting, that this is a bunch of medics who really get it and see its role in medicine. And I guess the purpose of that meeting was to bring all of these interested clinicians and researchers together and to sort of try to work out whether, microbiome science really truly has a role in medicine. And, I think by the end of it, certainly by the debate at the end of the conference, everybody was very much on side that microbiome science does have a role in medicine and should play a big role. And, that's really heartening to see. We're still a long way off, as you say, Shiv, but I really feel like if we have more and more medics, clinicians, surgeons interested, then maybe there is a chance that we can get this becoming much more mainstream than it is already. And there's some really good people driving it. So, I'm hopeful. I'm hopeful that it will get there, and hopefully before the 10 to 20 years that you're talking about.
Yeah, I suppose I'm talking about the sort of, the very sort of niche areas they're looking into. But this actually brings me on to kind of what we're doing and my T-shirt, which obviously this is an audio podcast, so no one can see it. But Sheena knows I kind of make these very cheap, like T-shirts, because we don't have any sponsors and we kind of just do it all ourselves. So this is my latest T-shirt. Sheena, I have one for you. And for the listeners who want to know what it says, I was trying to define microbiome medic because, talking about, we believe that actually you can be a microbiome medic now, that there are all these fascinating things in the pipeline in terms of probiotics, prebiotics, symbiotics, other uses for FMT other than for C. diff. But I kind of feel that we can bring this to the bedside now. So it's a T-shirt with a definition, which, is pretty short because it has to fit in a T-shirt. So I put trained healthcare provider using microbiome science to inform medical practice. So that's what I kind of think a microbiome medic is. So it's anyone who is, learning about human microbiomes and using that perspective to inform what they do at the bedside, which is, I kind of think, what we do. What do you think, Sheena? I mean, do you think
Definitely.
about the gut microbiome and human microbiomes when you're seeing your patients, and try and explain how that affects your consultation?
It affects every aspect of my consultation. I had somebody in just yesterday who we were talking about gut health. He had actually had a diagnosis of diabetes, and instead of going on medication, he decided that he was going to sort his diabetes out himself and do this via diet and lifestyle, exercise. And he'd done a brilliant job, put himself into remission from his diabetes on his own. And he'd done this without any support from healthcare practitioners. And he'd done this without any knowledge of microbiome science either, which, and we got chatting, because he was saying how disappointed he was with his, diabetes physician, who didn't support him at all in his endeavor to reduce it, to, manage his diabetes with lifestyle. And I said, well, have you heard of the gut microbiome and how that impacts upon diabetes? And he hadn't. And so we had a really good conversation about that. And he's even more fired up because his gut instinct was that he could do this with diet, but he didn't know the pathophysiology from a microbiome perspective and how that ties in with this. And so, it's really interesting for me as a physician to see how people can take hold of their own disease themselves and to use, really good mechanisms of reversing disease through lifestyle, diet, exercise, sleep, all the rest of it. But I can give them the reason why it works through the role of the gut microbiome and what you're actually doing when you're exercising and when you're changing your diet and how that is actually affecting things from a gut microbiome perspective. And that's just one example. I mean, there's so many different aspects of our role. I mean, I think of everybody who has a disease as having an element of gut dysbiosis. And I start from there and I try to fix their gut as a way of fixing their disease. And for me, that's fundamental to everything. But yeah, how are you using it, Shiv?
Yeah, well, I find that patients really like the narrative because it can seem very complex and a bit blaming when, as a lifestyle medic, you talk about their sleep or their diet, or it feels like a burden or a judgment on their lifestyles and their choices, which is absolutely not what lifestyle medicine is about. And it's very much focused on upstream determinants of health and inequalities in health, and the importance of behavior change and psychology and coaching and the science behind that, why we do what we do. Why I like the gut microbiome narrative is because it removes all that judgment. And it's really this wonderful story about the fact that you're, 50% microbial by cell count and over 99% microbial by gene count. These are team players in your body. And this idea that, I know it's humanizing it a bit, but this idea that they want to help you and can help you with every aspect of your physiology and health. And actually, if you feed them the right things and treat them the right way, they are an incredible team to have on board, and they're beneficial in so many ways in every aspect of your health and physiology. So I think as a narrative, patients really like it, because if you say feed your gut microbiome, whole food, plant-based, lots of polyphenols, colours of the rainbow, that's something they can go away with and do, and it kind of, they get it very easily, just a few phrases, and they like the idea of looking after the gut microbiome. It just seems to fire up their imaginations.
Yeah, absolutely. It's quite non-threatening, isn't it? And it's and it's something that we can all buy into. We can all see as something really, really positive. I am noticing the tide is turning a little bit. I think patients are beginning to understand that processed foods are harmful for them. And I'm having some really good conversations with my patients now about returning to whole foods, returning to home cooking, using fermented foods, and just getting back to real food again. And I'm really finding that patients are buying into this more. So that's really enthusing me just now. And my workforce in my GP surgery are definitely on board as well. And my trainees from the hospital seem to really take all of this on board as well when they join the surgery. So I'm also enthused by their their interest, and they're the new generation of doctors.
Absolutely.
And I think if we can get them interested in this, and they can then bring that forward for their patients for the future, that's great for me.
Yeah, I just wanted to say, Sheena, you just reminded me when you were talking there, the other thing that I really like about the gut microbiome and diet in particular is it's all about nourishing and abundance. Whereas so much of what we talk about is, negative, remove things, stop eating this, don't eat so much that. This is all about, we want more. We want you to eat more. We want an abundance of beautiful foods to fire up and feed the gut microbiome. So we want, more variety, more diversity, more whole food, plant-based stuff. So it's all about filling up your plate with beautiful food that's delicious and wonderful. And that's very different from the message there has been for the last few decades about, what you mustn't have, restriction, removal. So
calorie
this abundance,
counting.
So abundance and nourishing, it's got to be a good thing. It makes you feel good,
Yeah,
I want
definitely.
I want my patients to eat more, not less.
Yes.
Of all this beautiful food. And it's kind of, if they're eating the right stuff, they can eat as much of it as they want. So, so it's kind of, from that point of view, I really like it.
Definitely. It's got to be something really positive. But more than that, it's, if medics understood the mechanisms by which disease is forming through this disruption of the gut microbiome, then bringing disease back to those measures and considering, well, if everything comes back to damaging of the gut microbiome, that imbalance of the gut microbiome, then surely, you should be starting with lifestyle interventions and diet manipulation, not considering that as a side point, maybe a few months down the line once they've started the drugs. You know, that's where I'd like to see the shift, you know, and like to see people considering that, you know, what went wrong for that person that they ended up with this disease? What happened to them? You know, was it, what disrupted their gut microbiome? Was it antibiotics? Was it stress? Was it, you know, was it something catastrophic in their life? Or was it just poor diet over a long time, or, you know, poor lifestyle? And what can we then do to fix that? Rather than saying, well, you've got this disease, let's just dive in with this particular drug and that particular drug. Because you're then not fixing the fundamental cause of that disease, and whatever drove that disease and that dysbiosis could potentially drive another disease in the same person if we don't tackle that. And so for me, that's fundamental. And, you know, when my patients are being diagnosed with serious conditions like diabetes or rheumatoid arthritis or whatever, I'm thinking, well, what happened to that person? What went wrong? And how do I fix that so that the next diagnosis for them isn't a cancer or heart disease or, you know, something else that's going to be catastrophic for them? And it, you know, and how do we then, you know, control the symptoms of that disease by lowering inflammation in the body and improving the state of the gut microbiome? So I think it's that shift.
Yeah.
And that different way of looking at disease that I want to see more of.
Yeah, I mean, you're very much talking about a systems approach that we were taught as medical students. You're taught in compartments. You have respiratory, you have cardiovascular, you have endocrinology. Obviously, that's not the way the body works. It's working as this, you know, continual, dynamic, responsive, adaptive system. An important part of that is the gut microbiome and other human microbiomes. Now, we're not saying that those are the only molecular mechanisms, but certainly when anything shifts in the body, the ecosystem in your gut, for example, shifts as well. So it's very responsive and adaptive to what else is happening in the body. And you can't, you know, look at one part without looking at its effects on your gut and microbiome ecosystems. So, yes, so I just think it's a kind of easy way of getting your head around the idea of systems biology. It's like, you know, looking at the ecosystem and how your body works. I find it helps me, you know, think in a very constructive and positive way about the whole body working together.
Definitely. Okay, so we've talked about the gastroenterology meeting. We talked a little bit about the anesthetics meeting. What else have you been up to, Shiv?
Yeah, so there's the lifestyle medics are incredibly proactive about incorporating the gut microbiome, particularly, and other human microbiomes into lifestyle medicine. So the BSLM, our own organisation, the British Society of Lifestyle Medicine, but also we've been asked by other international lifestyle societies to come and talk, particularly Malaysia. We've been asked to talk at their conference over the last 3 years. And I find that quite interesting that they have embraced it so wholeheartedly. And I suppose it makes sense that these lifestyle pillars that we're talking about, so with physical activity, nutrition, sleep, connectivity, you know, time in nature, healthy relationships, it makes sense if we've always had the microbiome within us and we've co-evolved together with these microbes, that they will also respond positively to those things, whether it's relating to the circadian rhythm, to what we eat, to sleep, to stress, our response to stress. We know that the gut microbiome responds to all those things as well. So it is interesting that that medical speciality in particular has hugely embraced the gut microbiome, and we're being asked a lot to talk there. And that's why I was surprised when the Royal College of Anaesthetists asked us to come and talk, because that was kind of someone who I hadn't expected to reach out. But before we go on to that Royal College of Anaesthetists talk, which I think it would be really useful for the listeners to hear, not only how we kind of thought about doing it, but maybe talk them through some of the aspects of the talk. But there's one thing I wanted to ask you about, which was the Royal Society meeting that you attended. I think it was in October, which sadly I couldn't make it. But I wonder if you could just give us a brief summary of that and who was there and how you found it.
So that was a lovely meeting. The Royal Society put on a meeting for pretty much stakeholders in microbiome science in the UK, who, and actually not just the UK, in fact, because we had representatives from Amsterdam, and we had Jack Gilbert from the US. So quite an interesting bunch of people, researchers and clinicians, who were interested. I think the aim of that meeting was to ask the question, how do we get microbiome science into mainstream medicine? And so it was really focused on, well, what is the research? What's happening in microbiome science right now? And how does that relate to what we're doing in medicine? And then, what can we do as a group to forward microbiome science into mainstream medicine? So there were even discussions around the political side and how you actually how you get topics into Parliament. There was a really interesting discussion on that. That is not my area of expertise, I have to say, but really fascinating to hear about it. And Tim Spector was there, Jack Gilbert was there. And these are, obviously, if you've listened to Microbiome Medics podcast, you'll have listened to my discussions with them. But these are very big people in the field of microbiome science. And these guys are really driving forward the research, and they're driving the interest in microbiome science through all of their social media work as well. So fascinating, interesting. There is a paper being written off the back of that meeting, a scientific paper on forwarding microbiome science into mainstream. So it'll be interesting to read that when it comes out. It was lovely to be a part of it, to be honest. From all the work we've put in over the last few years, I felt like that was a bit of an acknowledgement for our interest, so it was really, really nice to be asked along. So
yeah, because it's quite a small meeting. How many people were there? It was
only, I think, less than 40 of us. Yeah,
really interesting. No, it sounds fantastic. Should we have a chat about the Royal College of Anaesthetists talk?
Yeah,
and
let's do it.
If I maybe kick off, because you kind of said, hey, they've asked us to come and talk, and I went away and had a think about it, and I thought, gosh, how should we do this? And I suppose the first thing that came up in my head was this idea that all doctors, but we're talking about anaesthetists here, you're not only a doctor of your speciality, so anaesthetics, you're also, unwittingly to most of us, a microbial ecologist. So an ecologist is, I suppose ecology is the study of the relationship between living organisms and their environment. So it's kind of how species interact, how changes in the environment impact species, and how ecosystems function, really. So as an anaesthetist, you will not be thinking that you're a microbial ecologist, but everything you do, when you're seeing that patient during the operation and when you're advising afterwards, will be affecting not only the patient in front of you, but the microbial ecology of all the human microbiomes, but we're focusing on the gut microbiome today. And I kind of thought that's a really sobering thought for all of us, really, that whether we know it or not, everything we do, say, every drug we take, every activity you do has an impact on your microbial ecosystem. So I kind of thought that was a good starting point. And then the other idea that we had was, quite often when anaesthetists do discussions, they divide it into three things. So preoperative, intraoperative and post-operative. So what happens before the operation, because quite often anaesthetists will see patients either immediately before or in the few days before. Ideally, they would see them several weeks before the operation so that they could build them up in a positive way to prepare for the operation. Then what happens in the operating room, in the theatre, and then how they manage a patient post-operatively. So I'll kick off with the pre-op stuff, and then maybe we'll move on from there. So we were thinking, when you see the patient in front of you, most patients who are in an operating theatre, but the fact that they're in a theatre having an operation means they likely have a disease, We know that people usually with one disease have more than one. Those people are often on drugs. And when people are on one drug, they're often on several drugs. So there's this idea of polypharmacy where you're on more than 5 drugs at a time. All these drugs are interacting with each other. Most of these people will have some degree of dysbiosis, and most people, because 60% of the UK population, consume most of their calories in ultra-processed food, will have dietary issues, and that will be affecting their gut microbiome. So I suppose drugs, Sheena, that was the thing that you highlighted.
Yeah.
What about the patient in front of an anaesthetist? How can they think about drugs, or how can we all think about drugs and the gut microbiome?
Yeah, absolutely. So I think when you're thinking about drugs, you have to consider that drugs in their own right can impact on the gut microbiome. And for example, antibiotics can have quite damaging effects on the microbial species, and depending on how wide-ranging or how broad spectrum these antibiotics are, they'll have different impacts on the gut microbiome and other human microbiomes as well. So they can have a direct impact like that. Other commonly used drugs that patients will often be on before they enter into that operation are things like PPIs. Proton pump inhibitors are essentially antacids. They're commonly used medications that reduce acidity in the stomach and help to get rid of things like stomach ulcers and gastritis, acid reflux, these kind of conditions. So very, very commonly used drugs. But what they do in altering the pH is they change the microbial ecosystem in the upper part of the gastrointestinal tract. So the stomach and the small intestine then becomes higher in pH. And that actually encourages more of the gram-negative bacteria, the ones that can actually cause more infections and disease. So you can get overgrowth of bacteria in the upper GI tract with time. And that actually means that there's more of these bacteria around that could potentially cause harm for the patient. If their immunity was dropped for any reason. So that could certainly alter their predisposition to infection potentially. So PPIs are very commonly used. And
so
then,
what about opioids and anti-inflammatories, which obviously is something that you might be on as a patient for pain relief from the condition which is taking you into the surgery?
Absolutely. Anti-inflammatory medications like ibuprofen, aspirin, these are effective painkillers, very useful, especially if you have like joint problems and things like that. But they are very inflammatory for the gut. They can cause damage to the mucus lining of the gut, and they can cause leaky gut. So they can, cause more inflammation within the gut microbiome. So they're not ideal. Opioids, again, can alter the ecosystem as well. So many different drugs. I mean, even SSRI antidepressants are actually antimicrobial to various different species like Staphylococcus, Streptococcus, E. coli. They are actually antibacterial. So they can alter the ecosystem as well. So, we're just beginning to learn the impact of many of our commonly used drugs on the gut microbiome. And so when people are on any medication, you have to consider that may already be altering that ecosystem in the patient.
Yeah.
So there's that aspect of drugs. And then there's the fact that the gut microbiome also can impact on the drugs. So everybody's got a unique ecosystem within them. Everybody's got a unique variety of microorganisms, and we all have different responses to medication and different side effects from medication depending on this ecosystem within us and how we metabolize those drugs. So that will impact upon the medications that we use in anesthetics, the pain relief we use. Everybody's different. And some people may tolerate those medications very well and some people may not. So that's an important consideration as well. And of course, if somebody hasn't had anesthetics in the past, you're going in blind, really. You don't really know how they're going to respond. but the ecosystem itself will determine your response to the medication that you're going to get.
Yeah. I mean, just going back to what you were saying about antibiotics, I mean, they're commonly used prophylactically. So that's to prevent infections during and after the operation. And if you kind of think, the rational side to that, we don't want infections. So people get blasted with antibiotics. The trouble is, although they kill potential pathogens, they wipe out all the beneficial bacteria. The other thing is a large percentage are resistant to these antibiotics. So you're wiping out all your beneficial bacteria. You're potentially wiping out some pathogens, but a lot of the pathogens now are resistant. So they get left with a clean landscape, devoid of beneficial bacteria that could potentially fight them off. And they're just, lying there in wait to cause these potential surgical site infections. And I guess that's a really, complex balancing act. But certainly this kind of widespread use of broad spectrum antibiotics for all procedures is being brought into question by some experts. So, that's something that we need to think about.
So when we're considering the pre-op journey, I think what's really interesting now is the interest that people are getting into prehabilitation. And anaesthetists in particular are interested in prehabilitation. So really, what is prehabilitation, Shiv? Do you want to talk us through it?
Yeah, I suppose it's preparation for surgery. So our good colleague, the anaesthetist, Dr. Sunil Kumar, wrote a book with Dr. Tony Brunning, I think her name is, Preparation for Surgery, which is a fantastic book. It's a program of preoperative interventions. So what the aim is, if you are a listener and you are preparing for an operation, there is an enormous amount you can do that will decrease the likelihood of surgical complications like infections, and increase your healing and recovery, and increase and improve your post-operative outcomes. So things like diet, I suppose it's all the lifestyle stuff, your nutrition, the way that you sleep, reducing your stress, connecting with people, moving, getting out in nature. All these things seem to affect your wound healing, your immune system through all these lifestyle mechanisms that we talk about a lot. And this has become a whole area of expertise that really aligns with lifestyle medicine, particularly with nutrition, for example. What you eat pre-operatively and post-operatively really matters. So, yeah, it's a really important area of surgery and anaesthetics now, which I'm delighted to see happening.
Yeah. And all the things you've mentioned, they all enhance your gut microbiome. And I think that's fundamental here, because if we enhance the gut microbiome, we keep it really, really healthy, we keep the gut barrier super strong, we get rid of any leakiness of the gut, we reduce the likelihood of any inflammation getting into the bloodstream, any of these gram-negative bacteria causing infection or getting, or creating even inflammation elsewhere in the body. So prehabilitation, I'm totally on board with, and it makes a lot of sense. What was interesting for me is how quickly you can get these changes. So patients are probably going to want to know, when should they start prehabilitation? At what stage should they be doing prehabilitation before they go in for their operation? What do you reckon, Shiv?
Yeah, it's a really interesting one, because I have to say, I suppose talking to most anaesthetists, they're saying ideally 6 weeks, 3 weeks, at a push. And I kind of got the impression that the way the NHS works now, quite often people, something incredibly high number, 40% of people are, have their appointment cancelled at the last minute, have their surgical slot cancelled, so which is really disrupting. And I know, and you'll know from patients who have to travel in for an operation, they have to be there at 7 o'clock in the morning. I've got one elderly lady who had to sort out her dog, sort out her house. She couldn't sleep all night because she was really frightened about it. So she left and got the taxi at 5 o'clock in the morning. She arrives and then gets finds out later that day it's been cancelled for, it's the third time she's been cancelled. But the amount of stress, the lack of sleep, she's turning up to the operation in a really less than optimal state. And that all impacts your immune system, your wound healing. So we've got to start looking at all these things. So I used to think, look, if as an anaesthetist you saw a patient a couple of days before, then what can you do? It's too late. But actually, I'm now changing my mind, because even one good night of sleep, and certainly if you're talking about nutrition and the gut microbiome, we know from studies, there was a study by David in 2014, looking at changes and how rapidly your gut microbiome could change. And they were suggesting that when they looked at human subjects, some within 24 hours, but certainly within 2 to 3 days, you could have profound shifts in the gut microbiome composition when you significantly changed your diet. And sometimes we're not talking about, what you are eating. We're talking about what you're not eating. If you remove ultra-processed foods, so you're removing things like emulsifiers and additives and non-nutritive sweeteners, which we know are toxic to the gut microbiome, you can get profound response very quickly. Now, whether that translates immediately into gut function differences is, less researched, but certainly, even a few days before your operation, if you cut out those ultra-processed food and pile in high fiber, fruit, veg, pulses, I would say there's never a time when you can't make changes before an operation, and how empowering that is for a patient to know that, what they do will make a difference. And I suppose if you're someone thinking, well, what actually difference does that make? I think a good way to envisage it is you're trying to bolster up your gut microbiome army. You're trying to get the best soldiers there, ready to fight infections, to ward off potential pathogens, but also to produce all these wonderful things such as short-chain fatty acids that we know will improve your immune system and bolster your wound healing and recovery.
Mm-hmm. And I think the other aspect to consider with this, that's talking about people with elective surgery, people who are having emergency surgery, who are perhaps already in hospital and they're waiting for surgery. Sadly, the hospital environment is not perhaps the best for your gut microbiome. There's an awful lot of things within that hospital environment that might be damaging for the gut microbiome. For example, lack of sleep if you're being monitored through the night. The hospital food, we know that the hospital food is very processed and lacking in fiber, lacking in fresh fruits and vegetables, and fermented foods. So if you are in that position and you are in hospital waiting for an operation, then personally I would be wanting, family members, friends to be bringing the patients in some lovely fresh fruit, something healthy for them to eat on the run up. Even, a lovely homemade soup, would be a really nice addition to the food that they're getting in the hospital environment to help, improve their nutrition and to help give them more fiber on the run up to surgery. So if you want to help your loved ones through surgery, then bolster their hospital diet with fresh fruits and vegetables and home cooking, and then consider the actual environment itself. If I've ever been in hospital, I always take earplugs with me and even one of those eye masks so that I can try to switch off from that hospital environment so that I can get some sleep. Because if we optimize our sleep, that's really important for our immune system and for our gut bugs. So we want people to be considering what they can do in that hospital environment to help that. And anybody who works in a hospital environment who's listening to this, think about your patients. They need the lights to be darker at night. They need peace and quiet in the ward setting to get some sleep. They need decent nutrition. It's nice if you can open a window and get some fresh air into a ward. It's really good if you can get patients up and moving more. They need some movement in their day to help keep them fit on the run up to surgery, and reduce stress for them. If they are under stress, what can you do as a hospital clinician or nurse, or to make that journey less stressful for the patient, because all of that will improve their gut microbiome, and that will have a knock-on effect of improving their outcomes.
Oh, Sheena, while you're talking there, you're reminding me of the kind of, Victorian TB wards where they would open all the windows, take the patients out into the sunshine, think about their food, reduce their stress. I kind of think, it's weird in 2025 that we're talking about these, Florence Nightingale type input
that's
instead
a dream.
Of high tech stuff. Yeah, we're saying that's a dream. An old sort of, even some of the London, there was an ENT hospital, or there was a group of hospitals that centred around a small but beautiful park so that the patients could come out in sunlight,
Amazing.
And be. So even back then, they understood the importance of that. And that's kind of because we're always looking for the latest high-tech, intervention. We've forgotten the importance of things like that. And actually, I guess the difference now as well, although they intuitively thought those things were important, in the last 2 or 3 decades, we now have this incredible, the molecular biology behind those things like sunlight at a certain time, circadian rhythm, sleep, the diet. We now have the research to back that up. And yet we still somehow don't see the potency of those mechanisms and how important they are and how destructive the hospital environment is. It's almost like the antithesis of everything that lifestyle medicine would suggest. It's kind of ripped apart when you go into hospital.
Absolutely. And we were having an informal chat with some of our anaesthetist colleagues on this very topic over breakfast. And one of my anaesthetist colleagues was describing her intensive care unit, which is in an internal part of the hospital environment and has no windows. So no natural light at all. And she was saying that actually she really struggles because the patients get circadian rhythm disruption in that ward environment, and it's having a big impact on their health and their recovery. And unsurprisingly, now that we know how important circadian rhythms are, and your exposure to light during the day is a very important aspect of that. So if you're not getting daylight, and sadly, the lights that we're exposed to that are artificial aren't giving us the sufficient light exposure to really set these circadian rhythms. And of course, people in intensive care don't have the ability to get out of bed and get, move around, pop outside. So they're really stuck in this environment. So again, seems like very poor planning on the by the hospital teams and the architects to consider that, the intensive care environment could be put in a place like that. And, very, very difficult for the patients in that situation and the staff.
I was just thinking that, Sheena. I was thinking about the staff when you mentioned, I know the girl you're talking about who was, lovely and obviously very caring, thoughtful doctor. But if you think about the staff as well, working in those places, and we know that, the lack of light, shift work as well. We know that there's concerns about metabolic health of NHS and other workers who are doing, shift work, and the circadian rhythm disruption is, ongoing, and the long-term sequelae of that for their health outcomes later down the line. Yeah, it's food for thought.
It is. So interesting. Right. Well, let's move on from prehabilitation. So obviously that is a really important thing that anybody can buy into and try and do themselves if they're having any operations. Let's move to the intraoperative period. So that time when you're in the operation, how does that impact upon your gut microbiome, Shiv?
Yeah, so I thought we're talking about similar things. So actually at the time of the operation, we're still talking about, lots of drugs are given at that time. They're often given another dose of antibiotics. Then there is the anesthetics themselves, so the thing that puts you to sleep, so you're not aware and you feel no pain during the procedure. And usually those are either given intravenously through a tube in your arm, or they call them the gas man. So they're given, you have a mask that you wear, and so you're having an anesthetic by gas. Now, there's not a lot of human studies on the effect of these things on the gut microbiome, but certainly in animal studies, we know that these drugs do affect the gut microbiome composition and function, but also they affect the gut motility. So again, if you're thinking of an ecosystem, anything that affects the environment, so alters the pH, or the humidity or the motility, slows it down, that's going to alter the type of bugs that thrive there. So, yeah. So you've got to think about those things as well. Then you're also talking about hospital environment. You talked about the things when the patient's awake, but also there's a high percentage of antimicrobial resistance in bacteria that are in the hospital environment as well. So that's an important thing to think about. And also these patients there's deliberate tissue injury. So if, for example, you're thinking about colorectal surgeon, they are deliberately cutting through the skin, cutting through the bowel. And although, I always found this profoundly strange as a medical student when I would spend ages hand washing and you'd have people watching you to make sure you weren't touching anything, and the degree of sterility had to be so high. And then an emergency patient with peritonitis would be brought in and the surgeon would cut through and suddenly you'd have feces everywhere. And it would seem, this kind of strange thing that we're talking about sterility, and suddenly you were opening up a gut in front of everyone. So that there is that aspect that the surgeon themselves are causing a lot of tissue injury and trauma, and that's increasing cortisol and activating lots of molecular pathways in the body as well, which make it more difficult for the body to fight infection. Yeah, so it depends on the type of operation, obviously.
Yeah, absolutely. So yeah, you get a lot of inflammation in the body just from cutting into tissues, and causing damage to tissues surgically. So that in its own right is very inflammatory for the body and very inflammatory for the gut. And just the stress, of somebody going in for an operation, sets that cortisol high, and they then can drive more of these harmful bacteria in the gut, and it's quite damaging for the beneficial species. So there's an awful lot going on, and sadly, all of these things sort of come together to create an unhealthier environment in the gut microbiome that can then have an impact on that person going forward. And talking about the gut transit time, anything that makes that gut more sluggish is going to then encourage more of these unhealthy, harmful bacteria to thrive. And so it's really common when people are in hospital for them to become constipated through the combination of the stress and the hospital food and all these drugs that we're giving them. But constipation, to me, is not a benign thing. It's not a benign phenomena. Constipation can be very damaging for the gut microbiome, and therefore, it can actually be damaging for the rest of the body. So it's something that, as a hospital clinician, I think you should be very aware of constipation and the harms that can cause. And so, it's probably appropriate to be using more laxatives in hospital while patients are there, and laxatives that are beneficial for the person that's in that position, like these lovely fibrous laxatives like lactulose that are going to actually benefit the gut microbiome. So that can be really beneficial in that sort of intraoperative and postoperative period.
Yeah, and I would also like to sort of say, because it sounds like it can sound negative for anyone out there who's about to have an operation or who's just had one. This can be swung into a very positive balance very quickly. So all of the things we're talking about now, so what's happening during your operation, if you a few days before your operation, try and look at these things, try and look at your fluid intake, your diet, make sure you're reducing your stress, trying to sleep, and actually realizing how important those things are can be very empowering, really. It makes a huge difference. And even if you haven't done those things and you're sitting in a hospital bed now, having had an operation, it is never too late to think about your gut microbiome. So don't worry about what you haven't done before. Don't worry about what happened in the operation. You can start all these lifestyle things now, and they will positively impact your gut microbiome.
Definitely.
Yeah. So, and we'll be talking about that in a moment, the post-operative things you can do.
Yeah. Well, actually, I think we should move on to post-operative now, because I think people are getting the message now, how important all of these things are. The post-op period is vital. This is an opportunity now to really heal the gut and to really get your health back on track. And if you take that post-operative period very seriously in terms of looking at your gut health, then you're going to impact upon your recovery, your wound healing, your likelihood of post-operative infections, and other potential complications, which we'll move on to. But in that post-operative period, what is it that can potentially harm that recovery, Shiv?
Well, I think we're talking about all the lifestyle things that we mentioned before. So, the hospital environment is not ideal. We're talking about lack of sleep. If you've not got a window or, access to natural daylight, your circadian rhythm is disrupted. There's constant noise, light, the stress, the high rate of antimicrobial resistant bugs. So I think, we really got to get our house in order or our hospital in order. We have to have, look at the architecture and environment in hospitals as a hugely potent way to improve, patient outcomes post-surgery and reduce costs, because the quicker patients heal, the quicker they, leave the hospital, the better for everyone. So there is, our focus obviously is on patient health and patient outcomes and caring for individual patients. But if you look at the NHS coffers and, the issues with finances, so this is incredibly important for that as well. So I think all those things together would make a huge difference.
And even for things like post-operative pain. So when you consider the complications that people suffer from when they have operations like pain, we know from our discussions with Deepak Ravindram that post-operative pain is very much influenced by the gut microbiome. So the severity of your pain can be reduced if you enhance your gut microbiome, and you enhance your circadian rhythms, and you reduce your stress levels, and all of these things, and you improve your sleep. And what we don't want is for patients to end up with chronic pain syndromes post-operatively, because their pain drags on and on and on. And we know that the painkillers in their own right can be damaging for the gut microbiome. So if we can improve the gut microbiome, we can improve their general health and their general well-being. That's going to reduce the pain. It's going to mean that they heal quicker, their pain will reduce and stop quicker, and they're less likely to go on to develop chronic pain syndromes. And that, that could save the NHS an awful lot of money, because chronic pain is a terrible sapper of NHS funds. But it's more so, it's really vital for the poor patients who are stuck in this endless, pain journey, which must be absolutely horrendous for them. Yeah. So, if we can try to get people's pain better controlled and get them healing quicker, get them out of the hospital environment faster, all of that goes to improving their pain and getting them back on track a lot quicker. So that's vital.
When you were talking about that, you reminded me, as well as, chronic pain, this idea that post-operatively people's cognitive function can be really affected. Can you talk a bit about that, this post-operative cognitive dysfunction, this POCD phenomena?
Yeah. To be honest, before we researched this, I hadn't even heard of it. But what I had heard of a lot is delirium in hospitals. And it's not unusual for patients, especially elderly patients, to develop delirium whenever they have something significant happen to them, like a significant infection or a big operation. And it all, to me, these things go hand in hand. But this post-operative cognitive dysfunction is specific to a loss of memory post-operatively. And interestingly, it's a similar mechanism to delirium. So it's created by an increase of inflammation within the body, and the levels of gut dysbiosis are common to that, and leaky gut is common to post-operative cognitive dysfunction, and a less functional gut microbiome is common to that condition. So less production of short-chain fatty acids. So a gut microbiome that is less metabolically active predisposes you or is associated with post-operative cognitive dysfunction. And essentially, what we're finding in these individuals is that they have higher levels of inflammation within the bloodstream, but also higher levels of inflammation within the brain. And so that inflammation within the brain is triggering this altered memory and problems there. So it all comes down to inflammation, gut dysbiosis, leaky gut, in my view. And so again, patients that pay attention to their prehabilitation, look after their guts are, in my view, less likely to develop this post-operative cognitive dysfunction. And why is that important? Well, it's pretty distressing for any patient to experience something like this, to lose their memory post-operatively. But actually, it's also an indicator for an increased likelihood of developing dementia in the future. So again, this is an important condition to consider and to protect our patients from. So that post-operative period is important, but the pre-operative period is also important in terms of, enhancing that gut microbiome and reducing that likelihood of developing this condition. Yeah. And the other really interesting condition that we came across was anastomotic leak. Shiv, you did a lot of research into this. Do you want to talk about it?
Yeah, I became very interested in the gut microbiome and its role in surgical site infections and anastomotic leak. And just for any listeners who aren't aware what an anastomotic leak is, an anastomosis is a join between two parts of the gut, usually. So if we take that as an example, you're having colorectal surgery for cancer of the colon. If the surgeon is removing the cancer, he then or she then joins the two parts of the gut together. And where that joins together, it's called the anastomosis. Now, what you want is you want that to heal well. And a really important part of that is the laying down of collagen, which are proteins that are key to wound healing. It literally knits the wound together, and you want a strong and flexible joint there. Every surgeon's fear is that there is a leak in this joint, and it's pretty devastating. The prevalence rates vary from anything from 4% up to something like 11 or 12%. And no one is really quite sure why this happens. I would say, well, it's obvious, isn't it? It's an infection, or it's a blood supply issue, or it's a technical issue with the surgeon. But actually, people can't quite work out what it is that makes some wounds break down and others not break down. And there is a professor in Chicago who is a gut microbiome professor and also a surgeon called Professor John Alverdi, who's been looking into this over the last couple of decades. And he thinks the gut microbiome are hugely important, particularly in surgical site infections and this anastomotic leak. There are certain bacteria, certain species that produce enzymes, and these enzymes are called collagenases. Now, a collagenase enzyme, think of it like a little scissor that cuts collagen. So they actually break down collagen. Now, if you remember a few minutes ago, I was saying you need collagen to knit your wound together. Then you have these potential pathogens that can increase in certain circumstances, which we'll go into in a moment. And if you've got a high number of these, you can imagine that you're trying to knit it together and all your work is destroyed by these bacteria that are breaking the collagen down. Now, these bacteria are often these pathogens that are in high levels, particularly after you've used broad-spectrum antibiotics, and if you've got a dysbiotic gut, if you've got, poor diet, and all the things that we've been talking about, they actually increase in numbers during the perioperative period. So you can see that the surgeon's trying hard to make sure the wound is healing. And the interesting thing about it is that surgeons really, feel terrible about this if their patients have an anastomotic leak. And yet the answer may not be all the things they're thinking about. A big part of it might be trying to improve and bolster your gut microbiome before surgery so that your gut microbiome team is carrying on the good work once the surgery's been done. Now, I won't sort of talk too much about this because I did get into a nice to and fro email conversation with Professor Alverdi, and I'm going to be talking to him in a couple of weeks' time. So we'll really sort of go into a lot more detail about this. But the thing that really struck me about him reading his papers was this. He was saying out of all the things you can do to modify your gut microbiome, and this is going back to the meeting we went to in Edinburgh, where they're talking about fabulous fancy pants stuff, the prebiotics, probiotics, symbiotics, fecal microbial transplants, all this exciting stuff in the pipeline. He said over and above all that, the most potent, affordable, effective, sustainable, equitable thing you can do to boost your gut microbiome prior to surgery is diet. And I found that shocking because he's talking about stuff that you can pick up at the supermarket. And that seems really, really potent and empowering to patients. There's this idea that, there's this, health inequality, that you can't access these fancy medications. And I know there are issues about inequalities in nutrition. I absolutely accept that. But we have to, get that good food to people, and we have to be, working to reduce the price so that the healthy food is the cheap food, so that everyone deserves this, and we're talking whole food, plant-based, a huge diversity of different foods. That's why there's colour of the rainbows. But again, not what you do have always, but what you don't have, reducing the emulsifiers, reducing the ultra-processed food, reducing the non-nutritive sweeteners, all that stuff. But I was kind of pretty shocked by how passionate he was about diet. And even a few days before, he's done some experiments. A lot of his studies are in parallel. So he does a lot of epidemiological studies looking at, he'll take all the surgical infection rates in the USA and do clever statistical stuff to them. He'll also take gut microbiome samples from those patients. But in parallel, he's doing animal studies. So there was one study he did last year looking at, it was anastomotic rates are increased in animals who have diclofenac, which is an anti-inflammatory, and a Western type diet full of these emulsifiers and non-nutritive sweeteners and low in all this fiber and whole food. And there's substantially significant increase in anastomotic leak if you have a poor diet. And he traced that back to an increase in the number of these pathogenic bacteria. So yeah, I found that really interesting.
And just looking at that post-operative infection, a lot of surgeons believe that the organism that causes the post-operative infection comes from the skin. And there's still common practices out there in terms of, using a lot of antimicrobials on the skin surface, before an operation, and also, bolstering up protein levels and things before operations with things like Ensure drinks. But what I would say about all of this is that, your research and our research has shown us that the staphylococcus that often causes the post-operative infection is thought not to come from the skin surface, but to come from the gut of the individual. So it's coming from the gut microbiome. And that's a really interesting finding for me in all of this research, because I would have always thought that it came from the skin. So to consider that your post-operative infection might actually be driven through the gut still is really fascinating. And yeah, I think that that's something that surgeons should be aware of. That really brings home the importance of the gut microbiome. And interesting, this week I was just chatting to a patient. So again, a patient with a post-operative infection that is dragging on. So a wound that's not healing, essentially, on a leg. And I started digging into the diet of this patient. And the patient had a very carbohydrate high diet. So bread for breakfast, waffles after the bread for lunch, certainly getting enough protein, but predominantly carbohydrate based. So you may not have a lot of sugar in your diet per se, but you may be consuming too much in terms of carbohydrates in your diet. And that is acting like a sugar in terms of driving the wrong type of microorganism in the gut, but also setting your sugar levels high in the body, which will then, the sugar levels going up and down throughout the day will then drive the wrong composition of bacteria in the gut. And that can prolong infections. And we also know from the interview that I did with my dermatology research colleague that the type of microorganism within the wounds is altering your wound healing, and people that are not healing their wounds properly have a slightly altered composition of microbes on the skin. So all of these things to me come together, and I think you might think that you've got a normal healthy diet, but perhaps it's the ratio that's not quite right there. Perhaps you've got too much carbohydrate in your diet and not enough of the fibrous plants to balance that out. And that's what I see a lot of when I dig down into people's diets, that they may be having their toast for breakfast, and then they might have their sandwich at lunch, but there's no fruits or vegetables involved in those meals. And then they have all their veg in the evening, just one portion alongside a big portion of carbohydrate with, a decent protein. And that's fairly typical of the Western diet that I see right now. And I think it's the ratio that's wrong. And if we were to get more, as you say, adding in more and more of the plants into that diet, then that would alter the way that you're metabolizing, and it would alter the inflammatory response within the gut.
Yeah. I mean, it is interesting because obviously there's a big move away from ultra-processed food, but, I appreciate that some patients, or many patients perhaps, have had chemotherapy, are feeling poorly, the appetite's gone, they're stressed. And I see the role of these concentrated food products, but we've always got to think food first, and, trying to move them, because there are a lot of emulsifiers and additives in these foods. And I think there is, we need more research around how we improve, if we have to use those supplements, but how to also to get people off them as quickly as possible, because a lot of my patients think that is better than food. They think that that's superior, and this idea that, food is, whole food is the go-to, and, you should use supplements only as and when, and you should try and, swap them out as soon as possible. Although obviously, as some circumstances I can see, there will be a role.
Well, I mean, again, if you consider that aspect, I'm not well, I'm in a hospital environment, I'm feeling lousy, I need my sugar, I need my chocolates, I need my, to feel better. Well, the research, and certainly Felice Jacka's research, actually says the opposite, that, driving sugar levels up when you're not well is actually going to make you feel worse. You're going to feel more tired, more lethargic. Your mood's going to be lower, and you're going to feel less energy. And Tim Spector voiced that as well. The one thing that people really noticed when they changed their diets to a more whole food diet and more fiber in their diet, their energy levels improved, their mood improved, and these weren't outcomes that he was expecting. But that's very typical. And my friend who's going through chemotherapy, she told me, "Oh, I need my white bread when I'm feeling, when I'm going through this." And I convinced her to try a different approach and try a healthier diet. And she said, "Oh my goodness, well, the days that I had that post chemo, I felt so much better." my energy was better. I could go out and do some exercise that afternoon straight after my chemotherapy. Whereas if I had my white bread and my sugar, I couldn't do it.
Yeah, I mean, that brings us back to hospital and food in hospitals. I mean, we've got the hospital food thing, which is kind of, there's very few hospitals that have a decent standard of hospital food. Most of it's ultra-processed, very unappetizing, and, very poor quality and likely to be detrimental to your health. But then I dropped a relative off at a hospital recently, and so walked into this new hospital. It cost millions of pounds to sort of update it. And there's about 3 or 4 ultra-processed food, fast food outlets there, sandwich shops, whatever, which are quite expensive. And just so this idea that the patient not liking their hospital food, they think, well, I'll shuffle down on my Zimmer frame with a relative and go and have a nice cup of tea and some other ultra-processed food at huge cost under the hospital umbrella. I mean, that messaging of that is, terrible. It's that, this place of healing and this place of science, this place of knowledge, the messaging is that this must be safe, this must be good, because the doctors and nurses and medical staff are, working under this umbrella and therefore must approve it. In the same way as you wouldn't expect now, there'd be an outrage if you went to your dentist and there was a vending machine and a pot of sweets that you could dip into. And if your kids were waiting for a while, you could pop round to a little cafe off the side of the dentist and go and get a fizzy drink and, some chocolate. People would see that as bizarre. And yet we haven't had that seismic sort of shift in mindset in hospitals about the importance of food and lifestyle in terms of the lighting, the ambience, the noise, the, connectivity.
So our appeal as Microbiome Medics is that everybody listening to this podcast who works in a hospital environment, can you think of how to improve your patient's gut microbiome? And can you think of ways that you can get this message through to your managers and to anybody in the local community that has any impacts on hospital environment? Because if we don't get these things changed for our patients, then we're really going to struggle with prolonged infections, post-operative pain, all these poor outcomes for our patients. And that we don't want. None of our patients should be suffering as a result of the environment that we're putting them in. And that's really vital that we start to look at this with fresh eyes now that we understand human microbiomes and all of these other things. So I think going forward, we now need to have a different approach. Shiv.
Talking about hospital food, the campaign for better hospital food in the UK, we'll put the links to that. So if anyone feels all fired up by this conversation and wants to find out how to make a difference and what's going on, then, have a look at that, because that's really interesting. There's a lot of traction behind that, trying to improve hospital food. So, yeah.
Perfect. Okay, let's talk about what's next. So obviously, we're going to go our separate ways now, Shiv, and we've both got things coming up that we're involved in. So I'm actually going to be presenting at the SOLAS Festival on Saturday, 22nd, I think it is, of June. I do a little presentation on gut microbiome at the SOLAS Festival in Errol Park in Perthshire in Scotland. Lovely little festival with a lovely wellbeing tent. So I'm going to be there again this year. I'm presenting with Janice Klein. Janice has been on our podcast. She is the fermentation queen of Scotland, and I'm really looking forward to being back together with her again. And we're going to be showing people a little bit how to make some fermented foods and how to look after your gut microbiome. So I've got that coming up. And then later on in the year, I'm doing a lifestyle presentation at the Primary Care Diabetes Conference in Birmingham in November. So Shiv, you've got a really exciting study day coming up, and I'm really actually gutted I'm missing it. But
I am we have to say gutted, yeah. There's Felice Jacka, who we're a huge fan of. She is a professor and she founded and directed the Food and Mood Centre at Deakin University in Australia. And even more importantly, she's the co-author of that kids' book that I was raving about a couple of Christmases ago. There's a Zoo in My Poo, which is a kids' book on the gut microbiome, which is absolutely incredible. But she is the lady who's done loads of trials into the effect of food on mood. Particularly the most infamous one was the SMILES trial. I think that was in 2017, which is kind of the first randomized control trial, which compared modified Mediterranean diet intervention with a control in adults with major depressive disorder and got very positive outcomes. So that's kind of kick-started this whole area of nutritional psychiatry and lifestyle psychiatry. So she and her team are in London, and we're doing a collaboration with the BSLM on the 28th of June. We'd love to see you there, although I suspect it's a very small masterclass. So I suspect the tickets might go really quickly. But if you're quick, we'll put some links here. And if there's any tickets, I'd love to see you there. So it's an overview of lifestyle medicine, the diet, the gut microbiome, gut-brain axis, mental health, and all the key mechanisms with the whole day. Felice Jacker will be there with some other members of her team, and there's a brilliant panel of experts as well. So that's going to be incredible, especially for any psychiatrists, psychologists, lifestyle medics, nutritionists, you name it, healthcare professionals. It's going to be absolutely incredible.
I'm gutted I'm missing that.
I know.
So,
but we will meet at the BSLM conference, which is the 18th to the 20th of September. So that, I think it's art and science transforming health, something like that. Anyway, it's going to be brilliant. It's in Brighton. Come see us there, and we'll put some links to that as well.
Lovely. Okay, that's fantastic. I'm really excited. We've got lots coming up. So nice to chat to you again, Shiv. Really nice to do a podcast together finally.
It is. I just want to say as well, it is lovely to see you. And also just, because it was your idea to, talk about the anaesthetic conference we went to. And I think it's really important. And it's really important that people who've listened to this then listen to next month's podcast, because we will be talking to Professor John Alverdi, who is brilliant and one of the top global experts in the gut microbiome. He's amazing. And it will be talking about a lot of the things we spoke about today, but really digging down deep into the molecular mechanisms behind a lot of his work. So, hope to see lots of you there.
Lovely. Right. On that note, thank you all for listening. If you enjoyed this podcast, please leave us a review. We need more reviews. So please leave us a review. And we will speak to you again. Bye, Shiv. Take care.
Take care, everyone. Bye now.
Bye. Bye.
Thank you so much for listening to this episode of Microbiome Medics podcast. We really hope you enjoyed the content and we welcome your feedback. We'd love to hear any suggestions you might have for microbiome topics that you'd like us to cover. And we also appreciate listeners' questions and will endeavour to answer them in the next podcast.